Okay, friends, hello and welcome back. My name is Ann Grace McMullen, and I proudly serve the IWMF as the Wellness Program Coordinator. And this job was born of an interest to help my father, who was diagnosed with Waldenstrom's in 2019. And my dad likes to say that having Waldenstrom's is not all bad, as it's given his daughter a job that she loves. Introducing this next speaker is yet another reason why I love my job. I was so thrilled to meet Dr. Alyssa Houston through the Society for Integrative Oncology earlier this year, and excited to learn more about her work and her center in the other Rochester, New York. The Pluta Integrative Oncology and Wellness Center, established in 2018, began much like the IWMF, through the patients themselves. Dr. Houston is both board certified in hematology and trained in breast medical oncology. And she spent many, many years fielding question after question from her patients about nutrition, exercise, massage, yoga, anything and everything they could do to improve their quality of life during their cancer journeys. Dr. Houston's drive to find answers fueled her research about how integrative modalities can help mitigate symptoms for cancer patients during treatment. And it fired her passion to grow the center from a small-scale operation to a comprehensive and cohesive community, where patients and their families receive ongoing, individualized, integrative support. As co-medical director of the Pluta Integrative Oncology and Wellness Center, Dr. Houston sees the direct impact integrative oncology can make on a daily basis. And she hears the same refrain from her patients: "I just wish I had found this earlier in my cancer journey." So I hope there are some doctors in the audience who have stuck around to listen closely to Dr. Houston's presentation. You can empower your patients to take part in their own well-being by utilizing integrative oncology programs like the one at Pluta. And WM friends, a lot of you are already taking advantage of integrative therapies, but I hope that this will continue to create a spark in you to ask your doctors for ways you can optimize your quality of life through integrative oncology. Without further ado, please welcome Dr. Alyssa Houston.
Good afternoon. Thank you so much, Anne, for that wonderful introduction. And it is truly an honor to be here today to be speaking to you all. This is my first time at this conference, and I can say that I've been so impressed this morning with the community you have here, hearing the talks this morning, and seeing what an impact all of you have been making in the area of Waldenstrom's. So as Anne said, my goal this afternoon is to talk about optimizing quality of life with integrative oncology, to really review the field of integrative oncology and its role in supporting quality of life for patients with cancer, to review the data behind specific IO-based modalities and several recent evidence-based guidelines that have been published, and then to begin to talk about how does one even implement an IO program? Or as a patient, how do you find programs and what are you looking for? So the concept of integrative care is something that has been really growing outside of not just oncology, but really throughout healthcare. This was from our local newspaper in Rochester, New York, talking about a program that the VA had instituted over 5 years ago called their Whole Health Program. And this was really looking at shifting the focus from a disease-centered approach to care to really a relationship focus, patient-centered and relationship between patient and provider. And they launched their program at about 18 different VA sites back about 5 or 6 years ago. And what they found when they were following patients is that patients reported better overall quality of life. When looking at specific instances like chronic pain that patients were experiencing, they found that there was less use of opioids, narcotics. The patients were able to taper off of them faster when using modalities like yoga, acupuncture, massage. They found that there were less overall healthcare costs, and that the providers also reported an improvement in quality of life from this shift. So we see this growing around us. The Samueli Foundation is a large philanthropic organization, and they looked at this through a patient and provider survey to look at attitudes towards whole person integrative oncology. So they were looking at this within the oncology world. And they queried 1,000 patients and 150 providers about the role of integrative oncology practices. And what they found was that over 60% of patients diagnosed with cancer wanted to know about complementary therapies. About 2/3 used at least one during treatment, and overall, at least half of patients and oncologists agreed that integrative modalities could help manage side effects and well-being. 76% of oncologists wanted to learn more about the benefits, but noted barriers such as, is there reimbursement? Which, unfortunately, for many of these modalities, there isn't yet reimbursement, but that's where we're trying to really show evidence and shift that focus in that landscape. They perceived other barriers, like the cost to the modalities. They perceived barriers such as where they weren't sure if their patients were truly interested. They needed more education and time. But 40% of patients said they would have chosen a hospital that offered some form of an integrative or complementary approach. So whenever we're talking about integrative oncology, I think it's really critical to start at the basics. What do we mean when we use these terms? Because they're different, and I always, when I'm seeing patients one-on-one in the integrative consults that I do, I always want to make sure that we're using the same terminology. So there's alternative care, and that's using a non-mainstream approach in place of conventional medicine. And that is not what integrative oncology is all about. There's complementary, which is using a non-mainstream approach together with conventional medicine. And then there's integrative, which is really bringing those two together, conventional and complementary in a coordinated way with a focus on treating the whole person. So in 1999, there was a series of 8 academic integrative medicine centers, and they formed the Consortium for Integrative Health in Medicine. That same year, Memorial Sloan Kettering Cancer Center created their first integrative medicine program. Other large academic cancer centers soon followed. So there's the Zakim Center at the Dana-Farber Cancer Institute. There is the MD Anderson Cancer Center has a large integrative medicine program, and many other when you benchmark and look at large centers throughout the country. Along those lines, and a few years later in 2003, the Society for Integrative Oncology was established, really with a goal of developing and translating evidence-based integrative care to oncology patients. So that has been their focus and goal. Then several years later in 2017, leaders of that organization came together and said, we want to create a definition. What is integrative oncology? So they published a definition that says that integrative oncology is patient-centered, evidence-informed, so using research evidence to guide the recommendations, using mind and body practices, natural products, and lifestyle modifications, alongside conventional cancer treatment to optimize health, quality of life, and clinical outcomes to really treat the whole person throughout their cancer journey, throughout that cancer continuum. And this has been the basis of what integrative oncology is. So what has happened since 1999 when these centers were developing, when large academic oncology centers were recognizing this? Dr. Jun Mao, who's the head of the Integrative Medicine Service at Memorial Sloan Kettering Cancer Center, published, this was several years ago, but had looked at large National Cancer Institute cancer centers, so these are the top over 70+ cancer centers throughout the country, and looked at a comparison of which ones incorporated any type of integrative modality in 2009, and which then in 2016, when they did this query, he hasn't updated it yet, but I expect we'd see even a higher increase. But what was that change over time? And I pulled just a few from the original article, but to note that acupuncture, massage, meditation, yoga. There was a 30% increase in the use of those modalities at these top cancer centers. The other thing to point out is that in 2009, there were not what we call physician or MD consultations with an integrative provider. And there was over a 60% growth in that over time. So really, these cancer centers looking at the evidence and recognizing the need to find ways in an evidence-informed way to incorporate integrative care. And that led as well during this time frame to a series of guidelines. It started back in 2007 with many of the national leaders within integrative oncology to create a basic integrative oncology practice guideline. That was followed several years later by a guideline looking at complementary therapies and botanicals. And then there's been guidelines specific for lung cancer. There was one in 2017 on breast cancer that then our Oncology Society endorsed a year later. And then most recently, there's been two that our Society for Integrative Oncology organization and the American Society of Clinical Oncology, which is the large oncology organization, international organization that we look to that helps us guide treatment recommendations. They've partnered on a series of guidelines. And that involved integrative medicine for pain management in oncology and integrative oncology care of symptoms of anxiety and depression. And the third guideline on fatigue should be presented at ASCO about a month from now. So we're really excited to see that third guideline. Alongside this, we've also seen, this is a snapshot from the National Comprehensive Cancer Network. Again, these are the National Cancer Institute cancer centers. Members of those centers come together and create guidelines. And we use those guidelines to make treatment recommendations. There's one for Waldenstrom's, there's one for all different cancer subtypes that we use to make treatment recommendations. They also have a series of supportive care guidelines, and 6 of the 12 have included integrative oncology or integrative modalities being recommended to help with managing symptoms. And so this is a snapshot, and we'll get to delve a little bit deeper in throughout the rest of this talk, but this is a snapshot, and this is what I use when I'm seeing patients, but of where many of these modalities have evidence and have made their way into what we can recommend for patients. So say, adult cancer pain, there's recommendations for acupuncture. For cancer-related fatigue, exercise, nutrition. Yoga is pretty much across the board. You're gonna get benefit from yoga. So I hope everyone's attending Anne's programs. But just to point out that these are the guidelines that we use on a daily basis. And I think this diagram really sums up beautifully how we see integrative care fitting. So at the basis is evidence-based conventional cancer care. That's so critical and important. The care that those of you who are on treatment are receiving, the care that we as providers recommend to our patients, chemotherapy, immunotherapy, possibly surgery, whatever treatment modality, that's critical and that's the basis. But building on that is then this philosophy of integrative care, patient-centered and personalized. Above that, lifestyle interventions, exercise, nutrition. We hear about that all the time, and we'll delve a little deeper into that. But those are so important, not just in your wellness, but in your cancer care. Mind-body medicine, stress reduction, spirituality. And then at the very top of the pyramid are specific complementary integrative interventions like acupuncture, oncology massage. So that's where this all comes together as a cohesive whole. And these are just some of the supportive care and integrative oncology tools that I use on a daily basis. And some may be appropriate to what you're going through, some may not be appropriate, but they're all there for us to be able to utilize and look to the evidence. That's kind of a theme, but I look to the evidence to then make those recommendations. But these are the tools in my toolbox that I look to all the time when I'm seeing patients in my integrative oncology clinic. So now moving into some of the specifics, movement, exercise, movement, activity. So important, one of the lifestyle interventions that we talk about all the time. And movement can be actual exercise, it can be yoga, it can be qigong, which is depicted underneath, which includes both a mindfulness and gentle movement piece. We know that exercise is important. We hear this all the time. There's the immediate effects. It can help with sleep. It can reduce your anxiety. It can lower your blood pressure. And then there's long-term impact from consistent exercise, helping your cognition, improving brain health, heart health. It can reduce the risks of other types of cancer. There's 8 different cancers that consistent exercise can reduce the risks of. It can help with bone strength. So many treatments that we give that you all as patients are taking can impact long-term your bone strength, your bone density, your bone health. Exercise can help counteract that and can help with balance and coordination. Yet, when you have a cancer diagnosis and when you're going through active treatment, you can experience a lot of fatigue. So how do you balance that? How do we fit this in? We know that fatigue can come from the cancer itself, or maybe the impact of cancer and Waldenstrom's from anemia that many patients develop, or it can be actually from the treatments having an impact on your body. And we know that cancer-related fatigue is a very chronic problem. In over 2/3 of cancer survivors, it can last for up to 6 months, even after finishing cancer treatment. 40% of patients describe cancer-related fatigue as being severe, and yet research has shown that moderate exercise during and following cancer treatment can reduce fatigue and improve overall quality of life. And there was recently a large analysis that was published. It was a compilation of a variety of different studies, what we call a meta-analysis, showing that even exercising 3 times a week, just up to 12 weeks, can really overall reduce that feeling of cancer-related fatigue. So where is some of the actual research evidence behind this? So this study was from several years ago, but this was a colleague of mine, Dr. Karen Mushkin at the University of Rochester, who completed what, again, is called a meta-analysis of a variety of different research articles. And her goal was to really look at what does the data say about individual modalities to help with exercise. And she's a long-term, well-respected exercise oncology researcher. So looking at that, and the other thing that they were looking at was what is the weight of that benefit? So on this, what's called a forest plot, what we see is over on this side, the interventions that were more favorable are further to that side of the graph, of the diagram. But you also need to look at the size of the squares. That's that weighted effect size. So what her study showed was that here at the bottom, the largest square over to the side, that corresponded with exercise. So it outperformed other modalities to help with cancer-related fatigue. And so this is something that we can do, but you need guidance, you need help, you need not every exercise is right for every different symptom. And I want to go back to those NCCN guidelines because, again, this is what we use. This is what can guide us in making our recommendations. And as you'll see, for cancer-related fatigue, the data, the research shows that for non-pharmacological interventions, physical activity has a high-level recommendation to help with cancer-related fatigue. The American Cancer Society has further supported this. This was a publication from a few years ago looking at both exercise and nutrition, the American Cancer Society guidelines. And we've heard these before, achieving and maintaining a healthy weight, but they start to drill down into what are those specific amounts of exercise that we should be doing to help with cancer reduction. So generally it's about 150 to 300 minutes of moderate intensity or a lesser amount, 75 to 150 minutes of vigorous intensity activity each week or a combination thereof. But we still need more support. So there's organizations. We have a program within our center that's focused just on exercise for our oncology patients. There's also partners within your community specific to cancer. So the Livestrong organization, which works with many local YMCAs, is a great resource because this is for oncology patients to be able to go in and receive input guidance about what is right for you. And then the American College of Sports Medicine has taken it even one step further. So our exercise physiologists that work in our center that have oncology training utilize this and other methods when they're seeing patients to drill down even further. So if a patient's coming in with anxiety, what's going to be recommended? Aerobic exercise. Maybe they don't need, though, resistance. But if someone's really hoping to improve their bone health, well, then the focus is going to be on resistance training. So we can really start to even prescribe exercise specifically for what symptoms someone is coming in with. So we all know that exercise can be helpful, and we're most familiar with the concept of rehabilitation. So someone has had something done, you've either gone through treatment, you're trying to build yourself back up. Most commonly, you've had surgery and you're trying to rehabilitate, get those muscles stronger. But we're looking at shifting the needle to something called prehabilitation, to really how can we start and engage earlier on. So for many of you who have Waldenstrom's, you may have a long period of time before you need to be on treatment, or may be on treatment for a long period of time. So how do you engage these services earlier so that you are at your best, either when you have to engage in treatment or throughout that treatment course? And that's really what the concept of prehab is, preparing someone for the anticipated stress and impairments pending some type of treatment intervention. It doesn't just have to be surgery. And so really what we see as the concept of prehabilitation is you have your diagnosis, you've been diagnosed, you have your treatment plan defined, what those treatments are going to look like, what those side effects are. And then the intervention is really a multimodal approach, focusing on exercise and nutrition. So for us, locally, we'll have our patients meet with our exercise physiologist and our oncology certified nutritionist to come up with a plan and try and engage that earlier right away to help that patient develop and maintain that function throughout the course of their treatment. And then treatment commences. That may be chemotherapy. For some patients, depending on their cancer, that may end up being surgery, but you're already engaging in those changes up front, which helps in the long run. And it also helps as we circle back to reducing that cancer-related fatigue that can develop while you're on treatment. So moving to one of our next modalities or areas that we frequently utilize are within the area of touch. We all know how important touch is on many different levels. We use touch in a therapeutic way within our center. And those two main touch areas focus on acupuncture and oncology massage. So acupuncture comes from an Eastern medicine tradition, traditional Chinese medicine, and it's really based upon the idea that we have this energy, this qi, and that you're modulating that with very thin sterile needles inserted into specific acupoints. Acupuncture has been used for centuries, and so it's something that has been fairly well established. However, more recently, from a basic science standpoint, there's been a lot of research to really try and understand mechanistically what is happening when someone undergoes acupuncture. So there have been animal models in the lab that show that after acupuncture, there can be the release of endogenous opioids, serotonin, dopamine, all those transmitters in your body that make you feel good, and which, as you can imagine, can then help with reducing pain. There's also been functional imaging that's been done showing changes in specific areas of the brain that are involved in cognition and emotion. So there's a science piece, what's happening at the level of these needles going in, there's another component to that that really impacts the whole person. And this is just an example of what one of those, there's 14 different meridians, and there are over 360 different acupoints. And these are just two examples of what the meridian looks like, the large intestine meridian. And then over here, we see a description of how one would access that acupoint. And this is important because the World Health Organization in 1984 standardized, this is from the book, but they standardized how you identify the acupoints. And that's been critical as research has been done, because if there's a study that says acupuncture helps with this symptom, that can be reproduced at other places. And so it's really helped in terms of improving the level of evidence that we have, in terms of the kinds of research and studies. We are familiar with studies in the treatment setting where you're comparing drug A to drug B, or drug A to placebo, potentially, depending on the way the study's been constructed. And so now we're able to do that kind of research with acupuncture. So this is actually, acupuncture can be used for many different side effects and indications, cancer-related pain, nausea it can help with, joint arthralgias that can happen from a specific medication we use to help treat breast cancer patients. Acupuncture has been demonstrated to help with that. The other area of active research is in chemotherapy-induced peripheral neuropathy. So this is research that was published by Dr. Ting Bao. Ting was at Memorial Sloan Kettering Cancer Center, and now she's at the Zakim Center at Dana-Farber as one of the co-directors of their integrative center. And her area has been chemotherapy-induced peripheral neuropathy. So this was a randomized clinical trial that she did where patients were randomized to either real acupuncture, sham acupuncture, so patients would come in, receive what they thought was acupuncture, but either the acupuncturist would use an area near the actual acupoint, or they would do what's called shallow needle insertion, so they weren't actually getting real acupuncture that just simulated it. So it's the placebo of acupuncture, or usual care. And patients received treatment for 8 weeks, and then they were followed for another 4 weeks. And what I'm presenting from her data is the mean change in chemotherapy-induced peripheral neuropathy symptom score at week 8. So they were doing symptom scores on patients throughout this time. And what you can see is that there was a significant reduction in pain and tingling as compared to the sham arm and the usual care arm. Numbness, there was a reduction in both, which was interesting. Both the sham and the real acupuncture had a reduction. What I want to point out, though, is that when you look at trials that use medications, we all are familiar. I prescribe these to my patients, gabapentin, Cymbalta, all these different agents that can help with neuropathy. When you actually go back to those studies, the degree of change, this was almost a 2-point reduction in the pain scale, is a lot less than that. So if we can't have an intervention that doesn't involve another medicine and is shown to have a reduction in pain, I think that's something that's really exciting to see, that there are other options available. It doesn't mean that someone doesn't still need to take gabapentin or another medication, but that we have additional adjuncts that can be used. The other thing is that Ting Bao is now doing a large randomized phase 3 trial that's being run. So this is going to be run on a much larger scale. This is a smaller study, but her study is going to be replicated right now. It's open and enrolling. So it'll be exciting to see what that shows. Along those same lines, she published looking at quality of life measures. So what she did was she did quality of life surveys for patients. There are a few different ones that she used. One was the Hospital Anxiety and Depression Scale and this functional assessment, which is the first one that really looked at neuropathy symptoms. And so she measured this at different time points and then compared real acupuncture to usual care, real acupuncture, or sham acupuncture to usual care, and then real to sham. And what was interesting is that both real and sham, compared to usual care, there was an improvement in the FACT score for neuropathy, and there was a reduction in anxiety, as well as a reduction in depression. But there really wasn't a change in real to sham, which was interesting. And so the authors noted, and I think this is something really interesting to think about, those patients were undergoing the process of acupuncture, they just weren't receiving acupuncture. And we know that that can be very relaxing and help with quality of, it helps improve. You're going through this process, you're relaxing, our acupuncturists play music, it's a very soothing time. So it seems that acupuncture may be doing two things. Maybe from a quality of life standpoint, it's helping with reducing anxiety, helping with mood, quality of life. In addition to as we talked about, some of the basic mechanisms of how it may induce some of those natural endorphins in the body to help with pain management. So it may actually be two things that are happening, but again, it'll be exciting to see what her larger trial shows us. And again, going back to our NCCN guidelines, acupuncture is considered a modality that can be used for neuropathic pain. And so that is something, again, that we do recommend for our patients in the appropriate context with the appropriate, acupuncturist and oversight. But acupuncture is an individual modality, and so it's not covered by most insurances, especially in the oncology world, although we're really working hard to try and change that. It is covered for chronic back pain and under Medicare. And some insurances, so I always encourage patients to, that's non-oncology back pain, I should say, some insurances do offer acupuncture as a benefit. So I always encourage patients to reach out and actually ask their insurance provider to see if it's covered. Acupressure uses those same acupoints as acupuncture, but you're actually using your own, either a finger, a thumb, or there's a device that can be used. And it's also been shown to release endorphins, neurotransmitters involved in pain modulation. It's been shown to promote relaxation, reduce stress, help with fatigue for oncology patients, and reduce inflammation. Dr. Susanna Zick at the University of Michigan has published a lot on this work and actually has an app that's been created through the University of Michigan to help teach patients how to use acupressure to kind of self-teaches where those points are, how long to press as a tool. So this may be something to think about for someone that lives far away from an acupuncturist or the cost is significant. We use this in a few different areas. Actually, we have a few videos that our acupuncturists have created specifically for neuropathy symptoms for our patients that are available, and it's another adjunct that can be used to help in reducing symptoms. And then that kind of leads into oncology massage, which is the other touch tool that we have. So massage in general is applying pressure to muscle and connective tissue, and it really is there to reduce tension and pain. And this isn't your typical deep tissue massage. This is typically a much more gentle massage that's a patient is undergoing. And I'll say this, I'll probably say this a few times during the talk, but it's always important to make sure that if you are going to someone like a massage therapist, that they do have additional oncology training. All of our massage therapists have undergone additional oncology certification and training. And as a patient, I think that that's critical so they understand there are nuances of massage. And if you're thrombocytopenic, your platelets are low, you're prone to bruising. Those are important things for them to know about how much pressure they may be applying. But those are nuances that they've been trained in that other oncology or other, massage therapists may not be as aware of. And it's been shown to be beneficial for pain, fatigue, anxiety, as well as for patients who are in a palliative part of their overall care. So that leads to the first guideline that was published in 2022 that, again, was this joint guideline between our two large international organizations, SIO and ASCO, coming together, looking at all the research and data, and this was led by Dr. Jun Mao from Memorial Sloan Kettering. So just to synthesize and review, I'll touch on a couple of the key guideline points. So for chemotherapy-induced peripheral neuropathy, that acupuncture was recommended for patients and can be offered to those experiencing this side effect from cancer treatment. And then acupressure, or they also included data on reflexology, which I didn't really talk about today, but that's another way of applying pressure to certain points that have been identified to help with reducing pain. For general cancer and musculoskeletal pain, recommendations were, again, acupuncture for pain that had more intermediate quality evidence and a more moderate recommendation than even the chemotherapy-induced peripheral neuropathy, again, as well as reflexology or acupressure. And additionally, I highlighted those too, but there were others that had enough evidence. So one was Hatha yoga, which is a specific type of yoga that can help, along with massage therapy and even guided imagery to help with reducing pain. For procedural, surgical, or palliative pain, hypnosis had evidence, although I'll caution that if you were to pursue this, you want to make sure, again, you have a very trained provider that's implementing and utilizing it, and acupuncture or acupressure. The additional ones that also came up in the guideline were music therapy, especially for procedural pain. So think about the pain getting a bone marrow biopsy, what that can be like, but how music may help with reducing that feeling of both anxiety and pain. And then massage therapy, as I mentioned earlier. So again, these are two large organizations looking at all the evidence, coming up with what's recommended, and this is how it looked. I will also note that there were also there were also areas noted where there weren't recommendations. So the guidelines are there not just to say these are recommended, but really to help weed out what we wouldn't do right now or what there's not sufficient evidence for. And so this is an overview, and again, what I use on a basis when I'm seeing patients within my integrative oncology practice. So now moving along to another core area, and if we think back to our pyramid, one of the other areas was mind-body practices. So that includes meditation, yoga, Tai Chi and Qigong, art therapy, music therapy, all of these different interventions that are really within that mind-body space. So mindfulness can be very powerful. It can be very helpful for patients. And there's strong evidence that meditation and specific types of meditation, so what we call mindfulness-based stress reduction or mindfulness-based cognitive therapy, where you're going through about an 8-week course of a mindfulness-based intervention, have very strong levels of evidence to help with anxiety and depression, mood disturbances, and quality of life. And I'll comment that a lot of the work, the reason that this says breast cancer is because a lot of the work has been done in certain cancer subtypes, but I think that's you know, a wake up to say, making sure we're including all cancer patients, making sure that studies are really broadened so that there is representation and we can better say, yes, these apply to not just one subset. Music therapy, which can help reduce anxiety during cancer treatments and procedures, as I mentioned, and progressive muscle relaxation and guided imagery, which also can help with mood disturbance and depressive symptoms. I'll also note that there is data for progressive muscle relaxation to help with hot flashes. So if any treatments are causing hot flashes, actually there's data, enough data to show that that's a moderate level recommendation. So yoga, and you have such a wonderful resource throughout your organization at the IWMF with Anne and what she is doing. I've been on your website and I've seen the classes that you have and some of the other webinars that are there. But yoga is also something that you want to make sure you have a practitioner, a provider, that has specific training so that they know what to recommend. There's different types of yoga. And these need to be tailored to the individual or to the kind of patient population. There's different poses, asanas. There's different exercises and stretches that can be combined. There's the meditation component, breathing exercises, all which come together during a yoga class. There's grade B evidence that yoga can help with treating mood disturbances and depressive symptoms, as well as to reduce anxiety. And the other interesting thing and exciting thing is that Dr. Bao also has looked at yoga to help with neuropathy and had done a study of yoga versus usual care for neuropathy and showed a significant reduction in pain from neuropathy. So she has a second study that's ongoing, a phase 3 randomized clinical trial looking at a yoga intervention that's actively recruiting. And so again, I think another exciting study to watch for, because the more tools we have, going back to our toolbox analogy, the more things we can pull into play to help with managing symptoms. We know that medicines are important. We know that for different symptoms, we have to prescribe certain medicines. But what are other things that we can partner with that to really create a cohesive plan? So at the University of Rochester, my colleague, again, Dr. Karen Mushkin, actually created a very specific yoga called You Are Yoga for Cancer Survivors, or she calls it YOCAS. And that's a specific combination of breathing exercises, 16 hatha and restorative yoga postures, and meditation. And she studied this now for over a decade or more in different subpopulations and has shown that there's evidence to help with the implementation of YOCAS for insomnia, for memory, and even in the breast cancer world, to help with joint aching that can help with, again, a specific medication that many breast cancer patients are on. She's even created a tool to be able to implement this, and I know is going to be launching further investigation into sleep and insomnia, because we know that that's something that can be very difficult when you have a cancer diagnosis or you're on treatments and your sleep is disrupted. So more to come with that, but just that there's the, yoga certainly has a lot of evidence behind it that we can use in terms of our implementation. And if you remember from that first chart I showed you, pretty much down almost all the different symptoms listed, there was benefit from incorporation of yoga. So that leads to the second set of guidelines that were just published this past fall, and which was really looking at integrative oncology for anxiety and depression. And just to circle back and highlight, there was high levels of evidence and a strong recommendation for mindfulness-based therapies for anxiety, as well as for depression. And our group looked at both, Our group looked at both patients during treatment and after treatment. So during active treatment and post-treatment. And as you can see, this is an overview of the guideline, that mindfulness-based interventions were across the board beneficial in all aspects of treatment, as was yoga, evidence across the board pre-post treatment. But there are certain interventions for anxiety and depression that may be more beneficial at a certain time point. So music-based interventions during treatment, but Tai Chi and Qigong after treatment. So again, it is really looking at the evidence and tailoring what those recommendations are to make the best individual recommendation for each and every patient. Okay, so now on to nutrition. We just had that amazing and wonderful lunch, and so it's a perfect time to talk about nutrition and the role that it plays, because it's so important in lifestyle. And this is, again, another core component of what we have in our center, our oncology certified nutritionist that meets with our patients. We know that nutrition is important in overall health, maintaining a healthy body weight, to help with side effects. So we'll often talk to patients about how, from a nutritional standpoint, they can help improve symptoms like nausea, constipation, diarrhea, along with the medications that we're giving them, but just giving more tools to be able to utilize. And one of the areas where there's been a lot of growth is in this area of really culinary medicine. And so really partnering with patients and teaching how to cook and prepare meals using a plant-forward, unprocessed foods. We have classes where we'll teach knife skills. If you're shifting your diet to a more plant-forward diet, you've got to learn how to chop, how to prepare. It may sound straightforward, but it may not be for many patients. So there is now a whole area, and many academic cancer centers have culinary medicine programs where patients and providers will partner together as a group visit and really learn and understand. Our nutritionists in our cooking class also talk often about the benefits of the different foods that they're pairing. So why is this one beneficial? What is it beneficial for? So really partnering with our patients to really work together and teach and educate. Going back to those American Cancer Society guidelines for nutrition, we know that we've all heard many of this before, but what a healthy eating pattern is, incorporating a lot of dark green veggies, a lot of fiber, fruits, whole grains, limiting red and processed meats, sugar-sweetened beverages, processed foods, minimizing alcohol. And it's interesting, the Journal of the American Medical Association just recently published an article looking at it was 10,000 cancer survivors they surveyed. And they were trying to look and see, well, how many cancer survivors are really able to comply, I guess is maybe a strong word, but adhere to these different portions of the American Cancer Society guideline. And what they found was that about 60 to 70% were maintaining the physical activity guidelines and a healthy weight. That dropped to about 50% in terms of the alcohol recommendations. It was about 20% that were able to incorporate the healthy, fruits, veggies recommendation, and about 4% who are able to incorporate all four. So I think there's a lot of work that needs to be done, but that's why partnering with centers that have resources, tools, education, it's one thing to just say, do this, but another thing to really come beside and say, here, we'll help, we'll teach you how to make those changes. So why is nutrition important? So we've talked about some of the basics of that, but why is it important for cancer? So this was a large, again, meta-analysis pulling together a lot of different studies. There was one that was published about 5 or 6 years ago, and this was an update to that meta-analysis, that was looking at the Mediterranean diet specifically, which has had the strongest evidence in terms of cancer risk reduction, and it's a healthy diet, it's a fairly balanced diet if you look at all the different components that are listed in this forest plot that I'm showing you, and that those, and the plot really shows you over here kind of the strength of each component of the Mediterranean diet in terms of how it's impacting cancer risk. And then at the bottom, though, is where it shows those cancer survivors looked at all-cause mortality among them. Those that had the strictest adherence to a Mediterranean diet had about a 25% reduction in their mortality. So that's pretty striking. And this is something that we can all do. It's something that we have control over. It's something that we can really engage in. Let me go back one. It's a little tricky today. So how do we begin to put all these building blocks together? How do we begin to pull everything and the data and the research? So this is a few photos from my center where I get to work and practice back in Rochester, New York. And so we didn't start here. We started with an oncology nutritionist, and we started with an oncology massage therapist. So we started very small. And then in 2018, we were fortunate enough to open our doors to our center that we have today. And now we're really looking at ways as to how we can expand, capitalizing on the virtual aspect of technology these days, as you have been doing with your wellness series, trying to help expand that footprint through virtual classes, hybrid classes, as well as classes and interventions right at our center. So the Society for Integrative Oncology actually looked to address this question of how do you begin to establish an integrative oncology program? And for patients in the audience, I think it's helpful as a patient to understand what are some of the important pieces that I should be looking for if I'm seeking integrative care. So this was a consensus paper that the Clinical Practice Committee that we just published that looked at all the essential elements. And I'm highlighting here the physician, the initial consultation, as being an important part of that whole process. And it really gives the opportunity to delve deep with the patient what their goals and objectives are. What are they hoping to get out of that integrative experience? What is their history? Are they using any current therapies? What are their current lifestyle interventions, their physical activity, nutrition, medications? Are they using any supplements? As you've noticed, I really haven't talked about supplements. And we really focus, as I'll show you, on the 4 core areas that I was talking about in our center. Now, there is research and evidence that some supplements can be helpful, but that is a very specific discussion that you need to have with someone who's knowledgeable and nuanced and has that understanding, because there's so many cancer treatments that can interact with supplements. So I think that really has to be done in partnership. The other thing is that if you can get some of those benefits from healthy foods, then we always encourage that over taking something else. But it's important to know if someone's taking that, and then we can walk through what that might be, to then really come up with a cohesive plan for that individual. And so this is just looking at some of the other building blocks that we included in the paper in terms of integrative therapies, nutrition, lifestyle modifications, and other collaborative needs. So there's a lot of the resources and tools that I've been talking about over the course of this hour that are listed here, but all of those may not be something that the individual patient needs. I think the other thing at the end that I want to point out is those collaborative needs, survivorship support, potentially palliative care, and then also external collaboration. So you can collaborate. There's often community resources that you can work with if you don't have a center that has an integrative oncology practice that's part of it. So this is what our kind of model looks like. And these are the different key aspects that we have. But as I said, we started with 2 people many years ago and have slowly grown to where we are now in those 4 areas of movement, touch, nutrition, and mind-body practices. And you'll see noted a lot of the different aspects that I covered today. Renew is our exercise program that was developed at the University of Rochester. But as I said, Livestrong is another great program, or your center that you're going to may have exercise physiologists, or even meeting with a physical therapist can be so helpful in coming up with an individualized but guided plan. So how do you begin to implement integrative oncology? And for patients, what should you be looking for? So as I mentioned, from a provider standpoint, I think having that integrative oncology consultation can be very helpful. And as a patient, understanding what some of those aspects are, so you know what questions to ask if you're meeting with someone, and you know why those different components are important. Focusing on some of the core components. And what I mean by that is, if you are at a center and they're starting to develop something, maybe they're just going to start with yoga like you have here through the IWMF. Or maybe it's an oncology massage therapist. There may just be a few core key areas that a center brings in to start to include as they're growing and as they're expanding their resources. I'll say it again, partnering with your local community resources, but I'll drive home the point that it's really critical that you look for oncology-trained providers. And there's different organizations that do that oncology certification and resources that can be developed to help you all, if that's something of interest. How do I know if someone has that certification? You can start by asking them, have you done extra oncology training? What is your experience with an oncology patient? Hearing this morning and knowing what I know over my years of working in both hematology and oncology, as Waldenstrom's is a rare diagnosis, you all are really empowered about asking those questions. So that's fair to say, do you have that extra training? Because you want to make sure you're going to someone that's going to be looking out for your entire well-being. And then education and training. And what I mean by that is for providers and even for patients, but educating those on these are evidence-based interventions and looking and understanding what that evidence is. And for providers, so what we've done a lot of is talking and educating and teaching my colleagues within hematology oncology about this is what we do, this is the research behind it, this is how we can help patients. And training, we have been working on and developed a training program called our Integrative Oncology Ambassador Training Program. So it's training nurses and nurse practitioners to be able to learn bedside skills. So we have a series of 4 modules on yoga, meditation, some nutrition education, and mindfulness, so that as someone may be getting their infusional treatment, they're feeling more anxious, that nurse may be able to draw on not just the medical practice, but be able to draw on, okay, maybe this is a time that we could talk through a short meditation that can help that patient. And I also, when I meet with patients, always say, and when we're talking about integrative modalities, it empowers you, it gives you the tools. If you're waiting in the clinic visit for your next set of blood work or your next scan and you're feeling anxious, well, there's research and data to say that a short meditation, not only we know will that help calm you, but there's actually evidence to really support that. So who will benefit from integrative oncology? So patients with symptoms maybe not optimally managed, and what I mean by that is they're taking all of the other medications, they're doing everything that they really need to do, but they're still struggling with fatigue, anxiety, sleep disorders, hot flashes, neuropathy. That may be a time to pull in other integrative tools. You don't have to wait for that, though. We can also pull those tools in earlier along in that process as symptoms are developing. Patients looking to increase quality of life. Patients newly diagnosed, those on active treatment, those in long-term survivorship. Hopefully you've seen where implementing some of these modalities earlier can help that prehabilitation concept and into survivorship and including and incorporating and continuing those modalities long-term. And patients wishing to actively partner in their care. because I would say that that is something that we have really observed, is that the incorporation of integrative oncology care really allows for patient engagement and to really create that sense of control at a time when you've had a diagnosis that really makes you feel like you've lost a lot of that control. You're actively partnering in your symptom management and your care plan. And some of the other benefits are that we see that therapies to reduce one's stress and anxiety, they also help improve that physical and emotional well-being during and after treatment. So I really see integrative oncology as fitting throughout the cancer care continuum. Initial diagnosis, active treatment, survivorship, or even in a palliative care setting, that there's research and evidence to support the use of integrative modalities throughout the entire cancer care continuum and process. So just to conclude, integrative oncology plays, I feel, an important role in supporting patients throughout their cancer treatment journey. And there remains a strong need for programs to provide evidence-based education and recommendations for the use of integrative oncology care for cancer patients. So I just want to thank you all for your time and attention this morning, for allowing me to share a little bit about some of the work that I've done within and my team within the integrative space. This is my team back in Rochester, New York. They are amazing, and none of this work would be done without this entire team. The other thing is, we are so fortunate, and I want to thank and acknowledge the Pluta Cancer Center Foundation, who supports and funds our center. And because of their support, our patients do not get charged for any of our services. So they can use all of our services at no cost. So we feel very blessed and honored to have them as part of our team, as well as the University of Rochester and the Wilmot Cancer Institute, where I get to practice. So that great partnership together. So with that, again, I thank you for your attention, and I'm happy if there's any questions. I think I left a little bit of time, so.
Thank you so much, Dr. Houston. That was very validating for what we're trying to do with the wellness program here. And I really just, I feel really excited and happy to see the research. And what she's not telling you, that her name is on all of those research papers up there. If you didn't notice, she's, very humble. So we have just a tiny bit of time for questions. If anybody wants to come up to the mic and ask a question of Dr. Houston. I had a quick question. Maybe it's not quick. If it's not quick, we'll talk about it over wine later. Yeah. I wondered if you could define quality of life.
Oh, that's a really good question, because I think quality of life, often when I think about it, when I'm seeing a patient, it's what is often important to that individual. That's why if you think about that integrative oncology consult, one of the things that we had on there was what that patient's goal is. For some patients, it's not having symptoms, and so that may mean that they're focusing on not doing certain treatments because they want to make sure they're mitigating symptoms. For others, their quality of life may be connected with reaching certain milestones. Now, there are a lot of quality of life metrics that we use that really measure those changes in quality of life, but I do think it's important to really hone in on what is important to that individual, really going beyond just that quality of life. The quality of life metrics help in that it allows us to include that in research studies that we do, but I really think one of the key things is what is important to that individual.
That's a great answer. Thank you so much. How can our Waldenstrom's patients find, go find an integrative oncology consult?
Right, so it probably depends on where you're being treated. Many large cancer centers do have integrative oncology programs. So many of the large National Cancer Institute, as I said, Dana-Farber, Memorial, MD Anderson, University of Pittsburgh, Utah, there's a lot throughout the country that have practices. There are some community-based practices also. There's a lot of those. as well. So my sense would be, if you're being treated at a large academic center, look there first, or look for a large center if it's nearby, because those centers often are going to have the greatest strength in terms of the research behind what they're doing. They are likely centers that are actively doing integrative oncology clinical trials that are underway. So that might be a start for patients. And then maybe that's something for, to collaborate on, or to figure out a list of places. If there's certain areas, I'd always be happy to help.
Hi, thank you for being here. My YMCA does have the Live Strong program, but I'm not able to do it because I need to balance the germs versus the exercise. So my doctor just allows me to do the pool, and I have to get there right away in the morning before everyone's germs it up, and then leave. And I would love to do the weights and all the other stuff. So what is your advice there?
So I wonder if there would be a way to partner, because, and you're right, immunosuppression is something, and within our center we have certain guidelines and keep our classes small, but you bring up a really important point that is a challenge for our patients that are on active treatment and whose immune systems are compromised. Just trying to think, outside the box, I wonder if maybe meeting with someone there, getting some trainer advice, having an opportunity to talk with someone to get a sense of what you could be doing, and then maybe those things you could do at home, or if you had a sense of what those recommendations might be. The other thing might be to engage really with a physical therapist, to do a one-on-one consultation if your provider would refer you to physical therapy, which I consider as part of that toolbox, to then, again, get individualized recommendations so you know that what you're doing. And lastly, thinking about, are there any Zoom programs like what you're doing currently with yoga? Are there other opportunities that might allow for some home-based exercise programs?
Hello.
Hi.
What about outdoors and hiking and stuff like that?
Oh, that's a whole nother area. That could be another partial talk. Actually, there's a whole area on kind of nature. I was just at an integrative medicine conference a few weeks ago in Cleveland and went to an entire session on kind of using nature, the idea of forest bathing. This, again, was actually from a practitioner out at Dana-Farber, was presenting at that workshop. But yes, that's really important. And there's a lot of growing evidence about the use of flowers and being outside and in nature, and how that reduces heart rate, blood pressure. So there is really, that's another key component, I think, that dovetails along. Absolutely great point.
Okay, thanks.
Thank you.
Thank you so much, Dr. Houston. This is all we have time for now, but if you see Dr. Houston, you have questions for her, she's very friendly. Just a note, housekeeping note, that our afternoon breakout sessions, you can go to them now. And you might want to, the virtual attendees might want to join our online WM community discussion hosted by Lisa Wise. Zoom link is in the session details. And if you have any other questions for Ask the Doctors, please drop those cards off before noon tomorrow. And again, thank you so much.
Thank you so much, everyone.